In this section, we will demonstrate use special methods of feeding children who are unconscious or children with severe acute malnutrition with poor appetite. First, we will describe nasogastric feeding, in which feed is given through a tube inserted through nose to the stomach of the child. Nasogastric feeding is needed when the child is very weak, unconscious, has mouth sores, and in children with severe acute malnutrition who is not finishing the 80% of the therapeutic feeds orally during the 2 to 3 consecutive feeds. Now let us see how to insert a nasogastric tube. Before inserting NG tubes or nasogastric tubes, ensure that the child does not have any food during past 2 hours. Also ensure that all necessary equipments and desirables are at the place. Before starting the procedure, remove all the hand ornaments like rings and watch. Wash the hands thoroughly with soap and water and dry them with clean dry towel or tissue. Now, wear the gloves. Now take NG tube of number 6 or number 8. Now, measure the length of the tube by starting from the corner of the nose to ears and from there to lower sternum till mid of the navel and make mark on the tube. Lubricate the tube with 2% xylocaine up to 2 inches, which will help in inserting the tube easily and will be less painful for the patient. Insert tube slowly from the nasal pathway till it reaches to the marked point. Once it reaches inside the nose until the mark, tie it slightly with the tape. To check the status of the tube, push the air from the outer end of the tube and keep the stethoscope between the lower sternum at midpoint of the navel and hear the sound of the air. If you are able to listen the sound, then the NG tube is at correct position. How to feed through nasogastric or orogastric tube. Check the position of NG tube every time before feeding the child. If there is some issue in the tube, then change the tube. If tube is okay, then give the feed. Remove the plunger of the syringe and let the milk drip inside. Important thing is to remember that there may be abdominal distension during NG feeding. Record the amount taken by the child on the chart. How to clean NG tube. After the child's feed is finished, pour 2 to 5 ml of warm water from one end of the tube and let it pass to the other end. There are few things to remember during NG feeding. They are: always wash your hands before feeding, ensure the correct position of the NG tube, and keep the nose clean. If any time during NG feeding child has difficulty in breathing or develops coughing, then stop feeding immediately. And do not reuse the leftover feed.